Story that needs to be told. I appreciate you being on with me this morning as well. Thanks.
Absolutely.
And we want to get back to our top story, Ebola in the United States. The Centers for Disease Control confirmed yesterday that a man who recently traveled from Liberia to Dallas last month has the virus. He's been in isolation at Texas Health Presbyterian Hospital since Sunday. We're also learning that 3 members of the ambulance crew exposed to the Ebola patient have tested negative, but they're being quarantined and monitored for the next 21 days just in case. Let's bring in Dr. Frank Esper, infectious disease specialist with UH Case Medical Center in Cleveland. Doctor, good to see you again. How are you?
Yeah, it's good to be here. Thank you, Jose.
A lot of people out there were just scared. How concerned should we all be?
Well, you know, this is something that, honestly, from an infectious disease standpoint, is probably inevitable. When you have an outbreak as large as this persist for as long as it has, we're going to start seeing sporadic cases because the world is very interconnected, and we start seeing people moving to and from these areas. But what's also important to know is that the reason we have these controls already to screen people who are leaving the area, to contact those people who are symptomatic, who start having fevers or start feeling sick before they even get on the plane. Unfortunately for Ebola, though, because the incubation is so long, up to 3 weeks, we can miss those people who are very early on exposed but don't develop symptoms until several weeks later, which is what happened in this case. But should we be concerned? No, because we have now identified the person. We're now working to identify any of his contacts, and we're going to be watching them very closely.
Dr. Frank Esper, thanks for being with us. It's important to clear things up and kind of mitigate the fear that many people may have. Thanks so much.
It's good to be here, Jose. Thank you.
Coming up, perhaps by now you've seen the hashtag I'm bilingual. I'll explain that hashtag and talk about how bilingualism and biculturalism help shape the voice of my next guest, the extraordinary